Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. A brief history of the birth control pill. Oral contraceptives, commonly known as birth control pills or just the pill, were approved by the FDA on June 23, 1960. Since then, more than 300 million women worldwide have used the pill for a variety of purposes, not just to prevent pregnancy. /r/n/r/n birth control pills have been used off-label to treat acne for years, but it wasn't until 1997 that the FDA approved of a combination birth control pill to treat moderate acne in women. Birth control pills are now used to treat endometriosis, polycystic ovarian syndrome, irregular periods, and more. /r/n/r/n The pill has revolutionized women's health over the last 5 decades. Here's a brief history of the birth control pill, why they're used, and how they work. /r/n/r/n In 1916, Margaret Sanger, founder of the American Birth Control League and forerunner of Planned Parenthood Federation of America, opened the first birth control clinic in America. Years later in 1950, led and co-funded by Sanger with her longtime friend Katharine Dexter McCormick, the initial search for safe and effective birth control pills began. /r/n/r/n A major breakthrough in the conception of the pill came when American chemist Russell Marker discovered that generations of Mexican women had been eating a type of wild yam called Barbasco root, also called cabeza de negro, for contraception. Marker was able to extract progestin, a synthetic form of the sex hormone progesterone, from this root. The progestin would eventually be combined with estrogen to formulate the first birth control pill. /r/n/r/n In 1957, the pill was initially approved by the FDA to regulate menstruation. By 1959, some 500,000 women were using it for this purpose. At that time, its ability to work as contraception was viewed as a side effect. In fact, the pill's packaging even came with a warning about its contraceptive activity. /r/n/r/n In 1960, the first birth control pill, called Enovid, which was manufactured by Searle, was FDA approved for sale as an oral contraceptive. By 1965, approximately 1 in every 4 American women under age 45 had used the pill. That number rose to 13 million women worldwide by 1967. /r/n/r/n Enovid was not perfect. Although it was effective and simple to use, it contained far higher levels of hormones than needed to prevent pregnancy. The first oral contraceptive contained 10,000 micrograms of progestin and 150 micrograms of estrogen. By contrast, modern pills contain no more than 150 micrograms of progestin and 50 micrograms of estrogen. /r/n/r/n The high doses of hormones also came with a heightened risk of side effects. Dizziness, nausea, headaches, and vomiting were common among the initial pill's users, along with an increased risk of heart attack, blood clots, and stroke. As a result, the pill faced immense criticism over many years, which helped refine it into the significantly safer and effective pill it is today. /r/n/r/n Oral contraceptives work by stopping sperm from joining with an egg. The pill does this in 2 ways, by preventing ovulation, and by thickening cervical mucus. /r/n/r/n Birth control pills suppress ovulation through the actions of the hormone estrogen either alone or in combination with progestin. In doing so, the pill prevents an egg from being released by the ovaries for fertilization by sperm, while also thickening cervical mucus so that sperm are unable to swim. /r/n/r/n The birth control pill doesn't just prevent unplanned pregnancy. It also offers a number of other benefits to the people who use it. /r/n/r/n Research shows that women who take the pill for at least 1 year are 40% less likely to develop uterine cancer and ovarian cancer. Other important benefits of the birth control pill include /r/n/r/n. The hormones contained in oral contraceptives also provide a protective effect against pelvic inflammatory disease, a major cause of infertility. /r/n/r/n. This protection is caused by the increased thickness of the cervical mucus that occurs when oral contraceptives are used. The thickened cervical mucus helps to keep bacteria from entering the vagina, and possibly the uterus and fallopian tubes, where pelvic inflammatory disease can occur. /r/n/r/n. Modern birth control pills are significantly safer than the earliest versions. But like all medicines, today's birth control pills come with a risk of side effects, including /r/n/r/n. Not everyone who uses the birth control pill will have side effects. When they do occur, they are usually temporary and resolve within 3 months of starting the pill. /r/n/r/n. Some birth control pills are associated with rare but serious complications. Specifically, combination birth control pills have been linked to /r/n/r/n. The risk of these complications is particularly high in people who smoke cigarettes. If you do smoke cigarettes, let your healthcare provider know. Progestin-only birth control pills may be a better option for you. /r/n/r/n. When discussing birth control pills with your healthcare provider, you should also let them know if you have a history of medical problems or are using other medications. /r/n/r/n. Be sure to tell your provider if you have any history of /r/n/r/n. Your healthcare provider will consider your lifestyle and medical history when determining the right birth control pill for you. /r/n/r/n. The birth control pill first came out in 1957, when it was initially FDA approved to regulate menstruation. In 1960, the FDA approved of the birth control pill Enovid for the purpose of contraception. Since then, over 300 million women have used it worldwide. /r/n/r/n. Birth control pills work by preventing sperm from reaching an egg. In addition to preventing pregnancy, the pill may also be prescribed to treat acne, endometriosis, polycystic ovarian syndrome, and more. It is considered safe and effective for these purposes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.